Welcome to Leadership Chats with Dr. Wise, the Not a Lecture podcast where we explore what it really means to lead in today's complex healthcare environment. I'm Dr. Wise, and in this series, we're having real conversations about essential leadership concepts. We'll talk about what you need to know, what you want to know, and what you'll actually use in practice. And yes, what you need to know to pass the exam. Each episode, I'll be joined by a guest expert who brings real-world experience and insight into nursing leadership, from managing care teams to fostering a culture of safety and everything in between. Whether you're listening on the go or settling in with your notes, this is your chance to deepen your understanding and connect what you're learning to real-world practice. No slides, no lectures, just meaningful conversations that bring leadership to life. So welcome to Leadership Chats with Dr. Wise. Today, we're diving into a topic that's at the heart of everything we do as nurses, and that is professional identity. As graduation approaches and you're preparing to step into your first role as a professional nurse, this conversation could not come at a better time. I'm joined today by Dr. Bredimus, who is the Chief Nursing Officer at Midland Memorial Hospital and a nationally recognized nurse leader. And we're going to talk about what it means to develop and live out your professional identity in today's fast-paced, high-stakes healthcare world. We'll explore how to show up as a professional, from boundaries and communication to mentorship, self-reflection, and growth. And we'll connect all of this back to how it matters in your practice, your leadership, and yes, even your exam prep. So let's start chatting. Welcome, Dr. Bredimus. It's nice to have you join the conversation today. And to get us started, why don't you tell us a little bit about yourself?
Thank you, Dr. Wise. I appreciate the opportunity. Anytime I get a chance to talk to students and anyone else listening out there. A little bit about myself. I am also a Texas Tech D&P alumni. I got my master's and my D&P from Texas Tech. I got my undergrad at the University of Texas Medical Branch down in Galveston. I've been a nurse now for almost 20 years. It'll be 20 years next year. So I started my career in Austin at what used to be University Medical Center Brackenridge, which is now a big hole in the ground. They moved over across the street to Del Seat Medical Center. Started on an ortho trauma floor there, then moved back to my hometown of Midland and started working in the emergency department as a frontline nurse. We worked bedside in the ER for a couple of years before moving into a director role in that emergency department. And then fast forward a couple of years, moved into the CNO role here at the organization now as well. So I've been with Midland Memorial for quite a while and happy to be back in my hometown.
That's awesome. And you have some great experience to bring from or to build from in our conversation today. So first, I want to start off by talking a little bit about professional identity and values in practice. So let's start with the big picture. How do you define professional identity in nursing? And would you call it the same thing as professionalism? So what are your thoughts on that?
Yeah, no, I think professional identity is separate from professionalism. Professional identity rolls up into professionalism, but professionalism is just kind of the broad scope of being a professional. That is someone that is part of a profession, which again sounds like it's just reiterating into itself. But someone who considers themselves a professional, maybe thinking about being timely, being well dressed, being prepared, those things, which is part of professionalism. But professional identity is really tied to who you are, who you see yourself as, and how you see yourself in the world as part of that profession. So when I think of like nursing professional identity, one of the things I always talk about with students and new nurses is that you don't say that I work in nursing, right? You say, I am a nurse. And that is part of that professional identity. Having that role imbues in it certain responsibilities, a ethical and moral responsibility, but also it's a social contract. As a nurse, you have an ability to influence individuals that comes with the role of being a nurse through that professional identity. But how you view yourself is then also a reflection of that. So how you present that into the world is part of that professional identity versus just being someone who is professional.
That's a great answer. And what a great example to talk about the fact that I think it just rolls off the tongue. We don't even think about it. I am a nurse. And that's more than just saying that you do nursing. So I really appreciate that example. Okay, so Our students are about to graduate and step into professional practice. So, what advice do you have for them about staying grounded in their core nursing values while adapting to the new environments and teams that they're entering into?
Yeah, that is a great question. I think it's the existential question we all face when we transition from student into professional practice. And so I always talk to our new nurses. We have a residency program here, and I always make sure that I get to talk to every new class that comes in, talk to our local nursing students. And I always talk about that first 6 months to a year. So once you graduate, once you get out there, right now as a student, your only thought is, I need to graduate and I need to pass the NCLEX. That's goal number one. And it's a fantastic goal. Then you think about, I get into my working profession, I get on my unit, I get through my residency, now I'm working, and it's in about that 6 months to a year mark where you're on your own, you've been doing this for a little bit now, and then that kind of paralysis sets in that like I'm on my own now. Like they're trusting me to take care of patients, and you feel like a fraud. Like they're going to find out I don't know what I'm doing. And
Right.
that is, I always tell everyone that is a natural, healthy feeling. That is okay. You're not alone. No one thinks you're a fraud. You do belong here. You do deserve to be here. That is just that kind of fear setting in that now you're part of the profession and your on ramp to that profession has kind of led you to this point. And it's about that year mark when you start to feel kind of comfortable in your own skin and you know what you're doing and you realize, okay, I can do this. I know what I'm doing. So always think about that when you're transitioning in is that imposter syndrome is real. It's a real effect. Everyone has it. And I always say that if you don't have it, then I'd be more concerned about you. I'd be more concerned about
Right.
the individuals who don't understand where their weaknesses are, or maybe they hesitate. They think about like what I know what I don't know. So really taking that as an ownership to be like, that's okay. That's okay to feel that way as long as I'm then also doing something about it. If I
Right.
understand that in my transition from nursing student to nurse professional, being grounded in that why you decided to go down this path anyway. Why did you want to be a nurse? I'm sure many individuals get to answer that question many times throughout their journey, but really remembering that and tapping into that this is why I worked so hard through nursing school. This is why I am now in this profession that I love, and this is what I'm meant to do. So always keeping that grounded center into your profession, and how you do that we can delve into a little bit.
Sure. No, that's a great opportunity to think about, when our students are graduating and they're moving into their professional practice. And yes, we will touch on this a little bit more, but you're not just going to as you graduate nursing school, for one thing, you are just scratching the surface of what you're going to know, right? When you get into your professional nursing role, you're not just learning more nursing skills or things to think about, but you're learning what it means to be a nurse as a professional as a whole. And there's going to be parts of that that are challenging as you work in those environments and teams and start to what we call socialize into that nursing role, which we'll touch on here a little bit more in a bit. But okay, so thing we emphasize in this course is that professionalism is not just how you look or talk. I think that those are what kind of first comes to mind. We think, I got to dress a certain way, I got to behave a certain way, say the right words. But really, what it is, how you behave when no one is watching. So, what does integrity look like in nursing practice, especially in high stress or ethically gray areas?
Yeah, I think with the morally gray, ethically gray area, I think that's one thing in nursing that we don't anticipate happening as much as it actually does. There are going to be times in your nursing practice, at least once, where you're going to run into this kind of moral dilemma or ethical dilemma that two competing priorities are going to run into each other, and you have to pick one or the other. And there's not always a clear and easy answer. So when it comes to integrity piece of it, it's having the courage to speak up and say, "Hey, I'm not really sure how to handle this," and that may be with a charge nurse or a mentor on the unit or someone that you trust, but having that courage to raise your hand and be like, "Hey, this is something that I'm not quite sure if I'm on the right path for this," or maybe you've already made a decision, maybe you've already done something and you find out later that that was not the right call, or maybe you made a med error or something of that issue. That is when you have to have the professionalism and the courage to step up and say, "Hey, I think I may have messed up and I need to try to rectify this situation. And I can use my own experience. I was 3 years into my nursing practice when I made my first medication error. And it was really challenging for me because I was, an experienced nurse. I was one of the leaders on the unit. And I made a simple error that I didn't catch until after it already reached the patient. And then it was that oh no moment that I realized what had happened. Now, luckily, the patient turned out okay. Everything was fine, but I raised my hand and I said, "Hey, I made a medication error. I bolused too much of this medication, and I really want to make sure that everyone knows so we can continue to monitor the patient and things like that." And I dealt with those consequences. I dealt with the ramifications of that. When you make a med error, there are some things that go with coaching and all that. But ultimately, I wanted to use that experience too to then educate my fellow teammates and be open enough to say, hey, I messed up. If it happened to me, it can happen to anybody.
Mhm.
Let's just tighten these things up and be aware of distracted med pass and those kind of things. But that was one of those crossroad moments when you had the opportunity to not say anything, and it probably would have been fine and everything, I could have gotten away with it, quote unquote. But when you think in that mindset, if you're afraid to admit when you're wrong or make a mistake or that you don't know something, that's when you start to get into that really dangerous area. And as nurses, we are entrusted to take care of patients. We have their lives in our hands. And so with that responsibility comes the responsiveness that you have to be able to step up and say, hey, I'm not sure about this. And who can I talk to about this?
Yeah. It sounds to me like there's some values that are present across, as an undertone to that professional identity and professionalism that we're talking about, things like being honest and having integrity and courage. And those give you the willingness and the motivation to step up and speak up when you need to. So which is vital and very important. I know you're aware there's a growing conversation right now among nurse leaders about a decline in professionalism, and there's concern that the professional identity of nursing is actually getting a little lost. And so, from your perspective, what do you think is driving this shift, and how can we begin to rebuild and strengthen that professional identity across the next generation of our nurses?
Well, this is a very hot topic. I know we've had conversations like this on the state and national level as well. My role in the Texas Nurses Association as president-elect, we've had these conversations on what is the image of nursing and what is it shaping into. And I think one of the key things I want to address right off the bat is, we talk about a declining of professionalism, but I really think it's just a different change in the
Mm.
mentality. I think there's a little bit of a shift in what a professional nurse looks like. And I think sometimes that can be confused as not being a professional.
Mhm.
Um, I think a lot of that, in my opinion, is shaped by how we present ourselves and what kind of content we consume. And immediately I think of like social media, right? Some of the most popular nursed content creators out there are typically skewing very negative.
Mhm.
I think of like the nurse Erica's and even Nurse Blake. It's funny stuff sometimes, but it always comes with that kind of negative skew. And I think that is starting to shape a little bit of the profession and what other people who aren't nurses, they see this content and they don't understand the context around it. So then it becomes this, is that what becoming a nurse means? Is that what that looks like now? And so I think part of that, we're not talking about nurses having to have white caps and starched uniforms. We're talking about how do you show up with your attitude into the work environment? How are you interacting with your patients and your family members? That's where the professionalism really, the rubber meets the road. And so I think that is also shifting with how our communication shifts as a society. We have moved away from a lot of in-person things and moved to more digital communication means that can make personal interactions a little bit more challenging. But on a positive note, we are seeing the next generation go back to some of the traditional means of communication, dating. They're
Mhm.
going back to in-person speed dating. They're going back to in-person meetings. There's that desire for that connection. So I think we're starting to see it shift back a little bit, but I always caution individuals when they're like, this next generation of nurses just doesn't have that professional drive like we used to. I think it just looks different, and I think we have to respect those generational differences. while also maintaining some core competencies and core elements of professionalism that do drive the profession.
Absolutely. Yeah. It's redefining it. I mean, and I think that happens, not with necessarily every generation, but we get a pause to think about what matters most. And like you said, there's some core competencies that really are essential. And those kind of, I think at the heart of them impact the patient experience. And that's what we want to make sure we keep as a high quality. And then this professional identity and professionalism plays into that. So if we kind of look a little bit now at professional behaviors and growth mindset. So let's talk about what professionalism actually looks like in practice. So, what are some key behaviors or habits that help a nurse show up as a professional every day?
Well, I think one of the first things that comes to mind is when you talk about professionalism in nursing, you think about that ideal nurse, right? Like who is that nurse on the unit when you do your student clinical rotations? Who's that nurse that you aspire to be like, right? And that's one of the first things I think of when it comes to professional, because clearly they've stood out to you in some reason. What are those skills that they bring? And I think as a an employer, some of the things that we look for are obviously the basics. You want somebody who shows up on time, and we always talk about, if you show up late, you're not hurting us. You're not hurting administration or leadership. You're hurting your colleagues. You're hurting your coworkers. You're hurting your patients because now they're having to wait longer to give a report and they're now delayed. So it's really looking out for your teammates in that aspect. The other one, again, is just how do you handle stressful situations, or how do you handle conflict? Those things are going to be important as a professional, not only in nursing, but in healthcare in general. You're going to interact with so many different professions within healthcare that you have to be able to understand those differences in communication styles, and how are you going to be able to then compose yourself to maybe articulate what you're trying to say a little bit differently, or understanding where this other individual is coming from and understanding how you may need to kind of craft your message so it is received appropriately. I think those are some key drivers, but ultimately professionalism is going to be, how do you show up every day to work, and what kind of attitude do you bring into the work environment? And again, I think there's that thought process like, oh, I can come in, a little late, a little frazzled. We had a wild night last night, but I'm here and I'm showing up, and that makes me the fun, cool nurse. Well, does it? Like, what does everyone else see when you show up like that? Because I see someone who's not taking care of themselves. Because yeah, maybe you can come in and live off of Red Bull and adrenaline and caffeine for another 12-hour shift. But are you bringing your best self to work? Are you bringing your best to your patients and your coworkers? And so that's what I think about on the professionalism side, is how are you taking care of yourself coming into the work environment, and how do you present yourself? And again, understanding life happens. There are things that happen outside of your work life that affect you when you come to work, and that happens, and we all understand it. And so that goes back to being attuned to each other and understanding, maybe Tiffany's having a rough day today, and I need to be a little bit more graceful with her. And so that way, when I need that same grace, she can give it back to me.
Yeah, there's some level of emotional intelligence that is involved in that ability to, um, you know, kind of gauge how we interact with others in our communication. And then I think about too, in your example of what you talked about, which I'm sure has happened a time or two,
Yeah.
we think about how you present yourself to your team, and then also to your patients and their family members. That first impression is going to set an idea of how they're going to trust the care that you're going to provide. And when you don't take care of you, it doesn't really instill a lot of confidence in them that you're going to be able to take care of them in the way that they might want to be taken care of. So there's a trickle down effect to that. But showing up with a mindset that I'm here to take care of people and their lives, then and that can kind of change maybe what those behaviors look like when you're coming into work. We looked at that kind of as at the day to day, coming to work at the bedside approach. But how do these professional behaviors show up in, our teamwork? You touched on communication, but teamwork or even social media. What do you think about that?
Yeah, I think how you interact within that team is going to be really important, because when you think about that professional nurse really integrates and leads the team. And every nurse is a leader. And I say that with absolute confidence that you may not see it now as a student and you may not feel it as a new grad, but just carrying the title of nurse imbues some leadership ability in you, that you are now part of a team. And at some point, you're going to be asked to step up and lead in one way or another, whether it's leading that family, whether it's leading a team on the unit, or whether it's leading hospital-wide initiatives or leading into other areas of practice. All of those are going to be really important. I think on social media, how you present yourself and how you communicate is probably one of the most challenging things that we see now in especially this political climate, right? Everyone's got thoughts and beliefs and things that they hold value and dear to themselves. But again, as a nurse, the society views us in a certain way, and we cannot erode that trust by having unprofessional interactions online or in person. So I always think about it in this manner. And I've dealt with a lot of social media, being involved in social media and trying to educate the public on public health initiatives. Obviously, public health is highly publicized and politicized right now. So how do you have those conversations? And I think about it the same way that I would educating a patient, is that you have to understand what their level of knowledge is, and then respond with facts and come from an educator's mindset. I'm coming to try to educate, not to chastise or correct, but really just provide the information so you can make an informed decision in that choice. And how we present ourselves online is important. The things that we promote online are going to be important. Are we promoting professional causes? Are we promoting things and resharing things that improve or promote the image of nursing? Or are we doing things that are going to degrade some of that trust? If we're posting things about how, unsafe nursing is now, or, how the environments are, maybe you feel that way. Maybe there's something that, your organization can do, or something of that action that you're trying to elicit that action. But be more intentional in articulating what that action is and what you are looking to do versus just what I call complaining, right? Versus just complaining online. What are the action steps that you are advocating for that need to move the profession forward versus just throwing your hands up and being like, well, it is what it is.
Right. That's a good point. It's not that you can never say anything, right? You have the right to use the various platforms available to you, but you just have to think about how productive is what I'm going to be saying. Is it going to, end up at an end result of possibly moving something forward? Or am I just coming from a stance of, like you said, complaining or arguing or ruffling feathers or trying to prove a point that is actually going to be non-productive and could be detrimental in the long run? So a few things to think about. So you're a chief nursing officer, so I know you've seen a wide range of professional and unprofessional behaviors. Would you be willing to share a few examples of unprofessional conduct that you've encountered and what the consequences were? I think it's helpful for students to understand what the real world expectations are once they step into practice. So what kind of things have you experienced in your role?
Well, I think, one of the most basic things is the time and attendance, right? Most organizations, most new grads are going to go into acute care. Most of those areas have some form of, self-scheduling. Either you put yourself on the schedule or there's a block rotation, but either way, when you're going to work. And individuals who consistently can't show up to work on time versus, everything that happens in the world, like traffic was bad today, my dog slept in, whatever it is. Those excuses don't negate the fact that you are not showing up on time. And again, that doesn't hurt us. That's hurting your colleagues. That's hurting your teammates and those kind of things. So that's one. And then showing up prepared to work. Again, I kind of touched on it briefly as an anecdote, but you think of that individual who comes in kind of disheveled and just, flying by the seat of their pants. That does not imbue a lot of confidence in your team and in your patient population. So that's one thing. And then one of the things I really want to stress to any nurse that is now getting into practice is becoming involved within your profession. And that means more than just kind of showing up, clocking in, doing your job, and going home. We are not just autonomous, beings that circle within each other. We are ultimately a profession. We have a collective voice. We are the largest healthcare workforce in the world. So when you talk about the collective voice of nursing, you have to contribute to that. You have to be a part of your professional organizations or even your unit level organization. If you're involved in a unit-based council or something like that, you have a voice and you have a professional responsibility to use that voice to advocate or promote or move the needle on something. But when individuals just, kind of float along, as you get into nursing, you will grow. You will grow professionally by just being there. But that intentional growth, that intentionality of what I'm trying to do and what things am I trying to make better for patient care within my organization or within the world. I mean, you can think globally and how you can make an impact. But really thinking about what are those next steps. And again, I understand it's a challenge for a new grad nurse because you are just now entering the profession and you're thinking like, I just barely made it as a nurse. Like, how am I going to then move this profession forward? But that's exactly what your role is. You are part of this group. I always use the example that my RN on my, after my name is the same as every other RN out there. There's no hierarchy or title. We all carry that nurse title. The state boards look at us all the same as nurses. We have that collective responsibility. Now, obviously, as you go on, there's different scopes and scales that you can do. But when you say that I'm a nurse, that has that power to then change perceptions and start to use that influence to really make changes in what we want to see within healthcare, within policy, within legislation. We have that collective power, but it only comes from people who exercise that power.
That's very good. And so it's important to show up, like you said, even in a unit-based level. And those are great places for new nurses to get started. A question comes to mind too, and talking about some of those unprofessional behaviors, which I know none of our students would ever do, but
Ever.
we have to, we're aware they exist out there somewhere in the world. So like, when you have issues with people who are showing up late frequently, or they're not showing up prepared or appropriately, or they're calling in a lot, or calling out is what people call it sometimes. They're just not showing up at all. What are some of the consequences, maybe in your organization? But what are some of the consequences that come with doing that on a routine basis?
Yeah, well, I always say that time and attendance is one of the most ignorant reasons to get fired. Like, like it should never happen.
Right.
You have plenty of opportunity to correct that behavior. But again, the frequent call outs and things like that, the first thing I think of as a nurse leader is, why? Why are they calling out so much? Is it something that is happening in their personal life? Is it something that's happening on the unit? There's got to be a reason. And then what can I do to help that?
Mm-hmm.
But as we dive into that, as I work with you and coach you and we work through those things, and it continues to be that behavior, as an organization, no matter which organization you go to, there's only so far that we can go to help you before it's like we have to take care of patients. That's our number one priority. And if we can't rely on you to do that, then we need you to separate. And unfortunately, it can lead to termination or things like that. Same thing with that unprofessional behavior. If you show up continually and you have a bad attitude, or you're constantly a hard person to work with, a hard person to deal with, that will affect you in what I call the branding and stranding. So if you ever want to move up in the organization, or you ever want to move into advanced roles, if you are hard to work with, if you're uncoachable, then that is going to brand you and strand you, that you'll be stuck there, and then you'll probably end up moving around a bunch. But you'll find that wherever you go, there you are. The problem follows until you can start to address those behaviors within yourself. And as you mentioned earlier, that requires a little bit of emotional intelligence to understand, how am I showing up and how am I being perceived by others?
Yeah, those are good points. And I think it's important to understand that the decisions we make today can impact us in the future. So it's important to make good decisions today. Not that every day is going to be perfect, and we need a little bit of flexibility, which is why there's those coaching opportunities built in and a little grace here and there. But it does matter how you show up on a day-to-day basis. So one of the things that we try to teach and stress is having a growth mindset and viewing feedback as a tool for learning rather than criticism, which is really important. We need to grow and learn in who we are and how we're doing our work as a nurse. So, in your own leadership experience, what helps nurses embrace feedback and reflection as a normal part of growing in their role?
Yeah, I think that feedback is one of the most challenging things to deal with, because no one likes to hear that they're doing something wrong, but I think ultimately that is the only way that you can grow. That's the only way that you can advance in your professional stance. So I always go into the thought process. I've always been one of those people that likes feedback. And especially constructive feedback. I want to know what I'm doing wrong so then I can improve on that. And I've always sought that feedback. In fact, I have a rule with my boss, and I always have, is that when I get to the annual eval, I don't want you to tell me that everything's going wrong. I want you to find at least one thing you want me to work on for the next year, no matter what it is. Find something. And I try to give that same feedback to everyone because we all need something to work on, something to strive for, something to be better at. So coming into it with that mindset, especially as a new grad nurse, there's going to be a lot of things you don't know. There's going to be a lot of things that you have the opportunity to work on. That being said, there's going to be some things that fit naturally into your strengths and into your sweet spots versus some other things that probably are not going to be your strengths. And I wouldn't spend a whole lot of time working on that. Start with your strengths, start working there. I'm a big fan of Clifton Strength Finders. So anyone out there is looking for a book recommendation, I recommend that quiz and reading that book, but really leaning into your strengths. And part of that is going to be that reflection on yourself, but then also seeking that feedback from others, because how you perceive yourself may not be how you're perceived professionally. So the only way you're going to see that is when you ask people for that feedback and try to seek some diversity in that feedback as well. If you're only
Yeah.
asking one person, it's always going to be the same answer.
Right. And we don't always want to ask the people that we know we're going to get the answer we like. I mean, we do need to
Right.
have honest feedback from a variety of individuals but having that idea of I want to grow, I want to develop, I want to learn makes that feedback less, I guess, threatening. But we look at it as it's something that's constructive and it's an opportunity. So, it can be tough for students and new grads to process mistakes or setbacks that they may make without feeling like a failure. So, what's your perspective on how to bounce back from a hard day or a misstep and still stay grounded in your identity as a nurse?
I think it's understanding that mistakes do happen, that we are all human, and that no matter how much preparation, how much education, you still have the opportunity to make mistakes. And even if you don't make mistakes, sometimes you can just have bad days. You can have those bad shifts. You can have something going on in your personal life, and then it just seems like everything's piling on at work, and those kind of things happen. That's natural, and that's okay. The real question is how are you going to respond to that?
Mm-hmm.
Knowing that those things are going to happen, knowing those bad days are going to happen, knowing that mistakes may happen. What can you do to mitigate it? What can you do to make sure that you're protecting yourself as much as possible from making those mistakes? But then recognizing that if they do happen, again, how am I going to respond to this? Is this something I'm going to learn from? Is this something I'm going to try to sweep under the rug and hope no one notices? Or is it going to be that opportunity for me to say, hey, I'm really struggling, guys, and I need help with this. And nurses are, stereotypically very, held to themselves. They won't ask for help if they feel like it's going to make them look weak or that they're an underperformer. But again, we need to recognize as a nursing profession, we're all going to oscillate in that area sometimes. We're all going to need help at some point. So it is okay to raise your hand and say, hey, I really need some help, like working through this problem or something like that. Because at some point you will then return that favor. You'll be working with a nursing student who's struggling or a new resident on the unit who is struggling. You will then have that opportunity to pour back into the profession that somebody poured into you. So be thinking from that mindset that I'm asking a lot of questions and I'm a sponge right now. I'm taking a lot of it in right now, but eventually I will be giving it back to the profession. I will be helping somebody the way that I want to be helped as well. So coming at it from that mindset, I think helps. Again, it's really challenging when you're in that situation because trust needs to be there. You need to feel that you are not going to be immediately criticized or chastised or bullied or anything like that because of your learning and you're trying to make that progression in your career. But I always start with that vulnerability and just being open with individuals. I tell people what I don't know and try to fill in the gaps for me, or that we're going to be learning through this together. If it's something that we're coming into this, I don't have all the answers, but I want to learn with you. Let's go on this journey together and try to figure this out.
Yeah, that's great. And, vulnerability and authenticity are two things we can add to that value list that work
Mhm.
really, really well for, developing your professional identity. And people really appreciate that too, because when I recognize that, I'm not perfect, I make mistakes, man, I've learned some of the failures I've had in my life. I have learned the best lessons from, and I'm who I am today now because of that. But when I'm vulnerable, it gives other people permission to be too. And we're just more of a supportive environment when we're that way. So failures are never, they should never be viewed at like, hard stop situations. It's just all over from there. It's just an opportunity to learn and to grow and, go back to that growth mindset type mentality. So let's transition a little bit to talking about evaluating our personal practice and having personal accountability for what we're doing in our professional nursing role. So, evaluation is a part of growth. We need that. We need the feedback that comes with it. So, when we look at that from a peer evaluation standpoint, what does it look like to engage in peer evaluation or accept feedback in a way that actually helps you improve?
Yeah, I think it goes back to that, establishing and building trust. You're obviously going to take feedback from someone that you trust more than someone who you don't necessarily know or view their feedback as constructive or valuable.
Mhm.
So it's establishing some of those connections and it's fostering that, but it goes back to that transparency, identifying someone that, like I said, you recognize them on the unit as like that epitome of the nurse that you want to be someday. Then go to that nurse and be like, hey, I want to be like you someday. I want to learn from you. I want to figure out what makes you tick, how you work through problems. And so, can I ask you questions about this? Can I, bounce ideas off you? Can you be that sounding board for me? And my role in this is that I just want to learn and help and be a better teammate for you. And so I think it's really about that courage to just again step up there and ask of individuals and on your peers. That is going to be the people on the unit that are even in leadership roles. Again, we are all nurses. We have different titles and management roles, but we are all nurses. So identifying those nurses that you want to be like or that you're receiving feedback from. Now, on the flip side, if you identify an opportunity in your colleagues and a genuine, sincere opportunity, not something that, like, oh, yeah, I can give you some advice on how to show up on time, but
Right.
how to like, hey, I saw you struggling the other day with this and this is something that I found has helped me. That kind of feedback is positive, and again, coming from a position of I'm not here to criticize you, I'm here to help you because I had to learn the hard way and I don't want you to have to go through that same thing.
Mhm.
So having that sincerity and that vulnerability, and again, of saying what, I had to struggle with this and I don't want anyone else to. So here's what I learned to make this a little bit easier.
Yeah,
Those things are the peer review feedback that you need.
yeah, that's great. And it can happen formally and informally too. But the informal feedback that you get from peers, built on trust is extremely helpful. And it'll start at the beginning, probably just from coming from your preceptor. That opportunity is already built in there, but it's something that we should seek out in an ongoing process. So, from for you as a leader, what is your approach to self evaluation? Because some of this, we do get feedback from others and in built in mechanisms, but it's important that we kind of take a pause and evaluate ourselves periodically. So, how do you approach that? And how do you know when something that you've done or a decision that you've made needs to be revisited or refined?
So I will typically, if I'm starting out with my, evaluation of a practice or something like that, I want to have those connected individuals, those individuals that I trust, and typically it starts with me saying like, hey, I'm working on this particular skill. So, for example, with my leadership team, when I was a new chief nursing officer, I wanted to really work on building better teams and building that rapport with each other. And I found myself in meetings kind of just steering the whole thing. I was just bulldozing everybody, like just doing what I wanted to. So I reached out to one of my directors and I said, hey, for the next meeting, I really want to work on this. It's something I've identified as an opportunity for me to be, kind of step back and let the group talk a little bit more instead of me commandeering everything. So I want you to give me some feedback if I'm either oversteering or if I'm, maybe responding negatively to someone's idea or something like that. If you can help provide me some of that feedback. And in doing so, that helped me grow. But I had to be vulnerable because obviously this is one of my employees. This is somebody that works for me that had to feel comfortable enough coming to me and giving me that feedback. And we'd worked with each other for a number of years. So there was that comfort level there. So that's important, but that, again, starts with me identifying something that I want to work on, having that openness to also hear about what others may have for you. So being open and eliciting that feedback. Is there something in a formal process? Sometimes we send out the annual evals where I'll ask my team, is there anything that you'd like to see me continue to do, stop doing, or change, or
Mm-hmm.
maybe tweak or something like that? And so that gives an open opportunity. And usually I don't get a whole lot from that, but 360 evals are can be very beneficial if they're done correctly. And a lot of organizations have gone to those. But really, again, eliciting some of that feedback and knowing what you want to work on and what your professional development plan is, and being transparent with that. I share my professional development plan with my team and my boss all the time of what I'm currently working on, things that I want to try to do in the next year, and then how I've done on accomplishing those goals or not.
Yeah, those are some great approaches that students can use as they move forward. And a great start with that is as you get into your new nursing role and you're paired with a preceptor or you're working alongside even other new nurses. I mean, you can ask just about anybody, what do you think about the way I'm doing this? Or I recognize I'm not doing this in a way I think I should, and get some of that feedback. But the important thing is that we're seeking it out, right? We want that continual feedback because we always want to be a little bit better than we were before. It's that, I don't know if, some people have talked about that, 1% better every day. If
Sure.
I'm just a little bit better, then I'm growing and I'm learning. It doesn't have to be huge leaps and bounds, but just a little bit at a time. So when we look at this process, it brings in a level of accountability. And accountability in nursing goes far beyond just owning up to your mistakes. It means being answerable to your actions and the impact that those have on others. Like you talked about with when we don't show up on time, it actually impacts the team, not just you in your position as an employee. So, this can include anything from patient safety and quality care to resource stewardship, advocacy, collaboration. So, from your perspective as a nurse leader, how do you see professional accountability show up in practice?
I think it shows up in, again, how you see the outcomes on the teams that you're in, but ultimately owning your own professional practice and that accountability are the things that that you're completing or not. If you're not doing your routine Foley care, if you're not doing oral care on a vent patient, you're going to see those VAPs go up. You're going to see those CODIs go up. And although it may not be you directly, you know that you contributed to that poor outcome.
Mm-hmm.
And so I think that's one of the accountability pieces, but ultimately it is always going to boil back down to you holding yourself accountable, because there are many, many opportunities in a professional world for you to cut corners and to not, go through the proper steps. And I think that's always been one of the things that as you transition from nursing school into actual practice, they'll be like, well, here's how we do it in the real world. Well, that doesn't always mean that that's the right way to do it. That means
Right.
that you found a way to cut corners, and maybe it doesn't compromise patient care, but maybe it does. And really looking at that critically and is like, is this the best way to do it? Why do we have to do it this way? And maybe that's where the answer lies. Well, the reason we do it this way is because this has been proven that it will reduce CODIs, CLAPSIs, whatever it is. So thinking on that professional accountability and that no matter what, if you do it the way we do it in the real world and something bad happens, and there's a poor outcome, then you will be held accountable to the process that you were supposed to be following. And it's never
Mm-hmm.
going to be like, well, everyone else does it this way. Well, they weren't the ones that had a bad outcome. You were, and you were the one not following the process. And so that's really challenging when you think about it from a nursing perspective, because it's like, well, yeah, I didn't create this shortcut. I learned it from someone else, but ultimately you're choosing, you're putting your license out there when you choose to take shortcuts or do those things. And
Yeah.
then ultimately it goes to the next piece of advocacy. If there are shortcuts that you have to take, what is it within your workflow that needs to change so you don't have to take that? Do you need additional support? Do you need different equipment? Like, what is it within there that you can then eventually address the bigger problem?
Yeah, that's a great point. Because sometimes, the shortcuts are not okay, but sometimes that they're happening for, I guess we could say, a good reason. There's something that needs to change in the workflow, but there's a proper way to go about making those changes. And I think it's really important to think about the fact that at the end of the day, our ultimate outcome that matters the most is our patients and their improvement. And I often say that we need to leave our patients better than we found them when we started our shift. And so every decision you make, you are accountable for what that influence or the impact of that decision is going to have on your patients. And that, I think, when we think about it from that standpoint, it takes it away from me and my decisions. It's more about me and the care I'm providing to my patients being the absolute best care that it possibly can be, which is at the root of why accountability matters. So to kind of transition a little bit, when we talk about professionalism and professional identity, an aspect of this is actually our self-care and our personal development. There's two different pieces of that: how I take care of myself and how I desire to grow and develop as a nurse. So when we look at nursing, it can be very incredibly rewarding. I think it's why a lot of people get into nursing, is because we want to take care of people, and it just feels so good when we know we've done something great to impact somebody. But just as rewarding as it can be, it can also be very exhausting, because our patients, the care that we're providing can be very demanding. The hours are long. It takes a lot of mental and physical effort. So, what are your go-to strategies that you recommend for maintaining personal wellness and resilience as a nurse?
Well, I think it boils back down to self-care, and when we talk about self-care, I think over the years, especially through COVID, it got kind of this like glamorized, like self-care spa days and things like that. And maybe that's a part of it, but really that self-care is the basic everyday stuff that's really unattractive, but the things that help you be a healthier person, a better individual. So getting enough sleep, making sure that you're eating healthy, making sure you're getting some regular exercise, making sure that you have hobbies, making sure that you have someone to talk to. All of those things are going to be very routine, very mundane, but that monotony and that mundaneness of it creates that structure that is going to make you healthier, happier, and a better person. So I always think about it from my perspective. I try to keep in mind on my diet, make sure that I'm even eating, making sure I'm eating my meals.
Right.
But when I do eat those meals, making sure that they are somewhat healthy. I'm not going to say it's all the time. I enjoy my snacks too, but ultimately, more often than not, eating something that's going to fuel my body versus something that's just a feel good snack type thing.
Mm-hmm.
Making sure I get enough exercise, even when I don't want to, getting out there. I'm sure many people can relate to that feeling where you don't want to lace up and you don't want to get out there, but when you do, you feel so much better, and you're like, I'm glad I did that.
Mm-hmm.
And doing that. So I'm a runner. That's what I like to do. I like to get out there and run. And then again, having those hobbies or those goals outside of the profession that are things that you're working on as well. So it's not always about professional development, but that personal development, that personal growth. What am I doing outside of my work? So I do a lot of volunteering. Again, I run. I'm doing all the world major marathons currently, and
Oh,
so
that's
really,
awesome.
yeah, I'm really excited. I'm doing Chicago in October. I'll be doing Tokyo in the spring. So getting closer to those 6 stars. But that's a goal outside of nursing that has nothing to do with nursing, but something that gives me that vigor and something to look forward to, and something that just kind of breaks up just the workplace thinking all the time. So those things are important. And again, as a shift work nurse, if you're doing those long hours, you're doing 12-hour shifts on your days off, how are you prioritizing some of your self-care, and then also prioritizing it on your days on? Are you waking up in enough time that you can mentally prepare yourself? Are you taking care of yourself after shift that you can recover and recoup? Are you giving yourself enough days off in between shifts? That's the other thing. We think about that grind, that hustle, and I got to pick up as much as I can for as long as I can. And yeah, everyone's economic situation is different, but always understanding that if you're just grinding and you're just picking up shift after shift after shift, you're taking away from your patients. You're chipping away at yourself, and you cannot then give back to your patients if you can't give to yourself. So I always think about it from that standpoint, that it's not selfish care, it's self-care, so that I can then take care of my family, of my patients, of my teams, so I can show up better and more prepared.
Yeah, it's such a good reminder. I think when we're individuals that highly focus on taking care of others, sometimes we're the I'm the last person that I'm going to focus on taking care of. But to your point in what you said, that we have to take care of ourselves if we're going to show up and do our best for our patients. We need to be rested so we can make clear good decisions, and we need to be well nourished, and like you said, the physical activity. I am not a runner like you, so kudos to you. I've got, I like to throw heavy weights around. That's my thing. But I'd probably be tapping out real fast on the run there. But anyway, we find our thing. Like you said, you find your hobby, you find your thing that's going to work your best for you, to help make you be well rounded the best you can be. And you did touch on this one thing, you said to make sure you talk to someone. I think we want to make sure that we remember our mental and our spiritual health as well,
Mm.
because those are just as vital and important as the physical health. And by addressing all of those things in the way that works best for you, not leaving any one of them unattended, you will end up being showing up the best every time, and also being very resilient in those moments, because there will be some hard days. And by taking care of yourself and having that good balance, those hard days will not be debilitating to you. You'll be able to bounce back and continue to show up the best that you can. So, to that point, burnout is something that we hear about often. And unfortunately, our new nurse turnover has been not so good because of this burnout that gets experienced. And some of the statistics around this can be kind of staggering. So it can feel a little discouraging for students who are stepping into practice and they're hearing about these burnout trends that have taken place over the past few years. So, what advice do you have for navigating that tension between showing up as a professional and still protecting your personal well being and responsibilities?
Yeah, I think, burnout is getting a lot of attention right now. And I think back to a couple of years ago, like burnout has gone by many different names. It's, jaded or, or,
Right.
crotchety, all kinds of other stuff. It's when you get to that compassion fatigue threshold and now you've
Mm-hmm.
gone past it and now you're not able to show up for your patients, or you're not finding the same passion within yourself anymore. So I always look at burnout as that's the end. There's a spectrum to burnout, and once you say that I'm burned out, that means that you've gone beyond what you're able to capably deal with. And so that goes back to resilience, and I know we are all tired of hearing about resilience after COVID, and I hear that all the time, and I agree. But think about resilience from the standpoint of grit and determination. What are the things that I'm doing that are going to take care of myself so I can avoid that burnout? And that's going to
Mm-hmm.
go back to that self-care piece. And then having the mindset of, I know that some days are going to be hard. And I know that there are going to be days when I call it work-life harmony instead of balance, because
Right.
there's going to be times when life, needs me more than my job does. And sometimes the job needs me more than my life does. So how can you find that harmony in that I feel satisfied in both realms of my life? I'm satisfied at work and I'm content, I'm happy, and I'm satisfied with my home life and I'm content there too. And that harmony is going to, again, ebb and flow, but it's not a balance. It's never going to be a zero sum game. It's always going to be fluctuations. And sometimes they will both shift up and they both need you. And the stress is going to be very high. So it's being, again, open, vulnerable, honest, making sure that you've taken care of yourself in that time period to be able to respond to that. And then once whatever crisis is over, then taking that time to recoup. And sometimes that's going to
Mm-hmm.
be maybe taking a little bit more time off work, scheduling that time away. Or maybe it's going to be, I have to catch up on some work. So I'm going to schedule more time with my family. And, next weekend, we're going to go to this stuff, but I got to catch up here. But finding that satisfaction and knowing that they are going to ebb and flow. There's never going to be that perfect balance. And understanding that as a professional, when you have, again, really long shifts and you got days off and big chunks there, what are you doing then to take care of yourself and prepare for the next go round, versus that constant inundation of always feeling overwhelmed? What outlets do you have to then start to take care of yourself so you can come back prepared and rested and ready to go?
Yeah, those are some good points. And there's some level of realistic expectations, I think, that are involved in that too. When we know that work is going to be hard, right? And we need to be realistic about what that is and what when a day has been tough and when we know we need to take a little bit more time. So there's some personal reflection in there, but know your limits and have some maybe I think for our students, take a little time to reflect on what are the signs that I'm creeping up to that point where I just feel like I can't handle it anymore, so that you don't get all the way to that point and you can intervene ahead of time and then have that routine of taking care of yourself along the way, is also very important in preventing that burnout point from getting there. So um, another aspect that's very important to our development is mentorship. And it plays a powerful role in shaping our professional identity, especially during that critical transition from student to nurse. So, from your perspective, what makes a great mentor? And how can new graduates go about identifying someone who can guide them and help them in their growth?
I think this is it's kind of a loaded question, so I'm gonna change it just a little bit. So from the mentor perspective, really you can find a mentor in many different places. It doesn't have to be that sage executive or faculty member who seems to have it all together and is just like that glowing epitome of nursing. You can find mentorship in peers. You can find mentorship online. There's a lot of different people that you can receive that kind of feedback and coaching from. Now, the best relationships are those ones that you can foster and grow. But realize that I think sometimes there's that perception of like, if I'm going to find a mentor, that means like it's going to be my Tuesdays with Maury and like it's going to be this lifelong bonding connection. And sometimes that happens, but realize it's also kind of like friendships that there's going to be seasons where maybe you have this mentor for a while and you learn a lot from them, but then you may grow to a point where you've outgrown that mentor and now you need to seek different advice, or maybe you're looking to supplement a different area of your professional practice that this mentor may not be the best one to accommodate that. But when it starts out, I always think about from the mentee perspective. If I'm the one that's seeking out a mentor, I come with a clear objective. What is it that I want to get out of this relationship? What do I want to learn from this person? And some of the easiest ways to start generating that conversation or generating mentor leads is just asking those people that you do admire, or those people that seem to be in the positions that you want to be in someday. How did you get here? What was your journey? Like, talk to me about what that looked like for you. And then that really opens up the conversation to start then, what do I need to do to then be where you are now? Or, where I am in my professional career, I want to get to this step over here. Can you help maybe walk me through some steps? And I think it's important to recognize that mentorship is really driven by the mentee. The mentee is the one that really needs to bring the questions, bring the work. Because as a mentor, I've mentored many individuals over my career. You don't want to have someone who continually asks questions and then never does anything with it, right? You don't want to be that individual who's always asking and never doing. So that's a quick way to burn out through mentors. So come with the questions, come prepared, know what you want to ask. And sometimes it evolves naturally. Sometimes you'll get into an organic flow of conversations, but always be thinking about what's that end goal that I'm working towards. And maybe it's really fuzzy right now. I don't really know. But what are the next steps then that you should be thinking about? And how you select a mentor is going to be based on usually proximity, who's within your organization, who's on your unit, what are some of your social networking connections? And then, of course, I'm a big fan of professional organizations. Joining your nursing professional organizations. Texas Nurses Association is the largest one in Texas, but even joining your own subspecialty organizations are a great way to get connected with individuals that are further along in their journey that you can learn from.
That's a great point. And I think that, I don't know, I think it's always good to have, at least one mentor, just at least one person that you can go to on a, routine basis and bring those questions. And I think when you have that individual in your life, whether it's personal or professional, honestly, you all that contributes to that growth mindset. There's always that little bit of feedback. There's always somebody there to help you look at things a little bit differently. And it can really make a difference in where you go and how you grow as a nursing professional. So on a personal note, can you share with us one of your most impactful mentors that you had early in your career and what you learned from them?
Yeah, I always go back to my mentor and friend Bob Dent, another Texas Tech DNP alumni, and my former boss. He was the CNO before me. It started with that exact same conversation of I asked him like, "Hey, how did you get where you are? Like, what steps did you take, and how can I grow myself professionally?" And that evolved into a formal mentorship role. And again, it may not always be a boss or a superior or anything like that. In this case, it was. But learning from Bob, looking at his steps, asking questions, getting feedback, eliciting that feedback from him on how I can grow. He's really helped me in my professional journey to become, the leader I am today. And I always tell him that. And he does some great work out there. If you ever are on social media, I recommend you check out DBD Consulting and Bob Dent. He's got a lot of great work that he's now doing with vulnerability in the leadership realm about dealing with your mental health and making sure that you're really out there with your journey and understanding that everyone is struggling in some capacity. And so what can we do to be more understanding and prevent that? So he's done a lot of great work with that, and he's always been a mentor to me. So I go back to Bob as probably my number one mentor.
Yeah, that's a great example. Thank you for sharing that with us. And it's a great example of your recommendation and application. I mean, obviously, look, now you're in that chief nursing officer role. And I know that there's a lot of different things that went into play for you to advance to that position. But what a great impact of having a mentor there to help guide that process for you. So that's awesome. So, well, this has been a really meaningful conversation, and we've explored a lot of things around professional identity and staying grounded in self care and reflection. And I want to stress how important those topics are because they directly impact how you practice. They impact how you lead, how you show up for your patients and your team that you're working with. So I always promise students that I'll take this information and try to make it look like how it's going to show up on the exam by doing a few practice questions. So, would you be willing to answer a couple questions with me?
Absolutely.
Awesome. Okay. Well, let me get them pulled up here for us. So, all right. Okay. Can you see those okay on your end?
Yes. Uh-huh.
Perfect. Well, I have three questions here for us, and these questions are going to take some of these professionalism concepts that we were talking about and put them into some real situations. So, what I'm going to do is read the question. I'm going to read the answers in case we have somebody who's just listening and not, reading on the screen, and then I'll let you take a stab at it. So, and I can help you if you need me to. So,
Okay.
I have a feeling you got this. Okay, so question number one. The home health nurse is providing long term care to several clients. Which are examples of inappropriately crossing professional boundaries? Select all that apply. Everybody's favorite type. So we're going to start with A, accepting a birthday gift of a gold bracelet from a client. B, offering to pray together if a client so wishes. C, sending a sympathy card to family after a client dies. D, soliciting a wealthy client to invest in a company. And E, staying after work hours and drinking wine with a client.
All right. Well, we can knock out some of the easy ones first. So, soliciting a wealthy client to invest in a company is a big no-no.
Yes.
You don't want to cross that professional boundary and asking them for money. Staying after work hours and drinking wine with a client is also when you are in that professional role as a nurse. Drinking and collaborating with your client, your patient, is also one of those crossing of the boundaries that you don't want to do while you're engaged in that nurse professional relationship. I think the accepting a birthday gift of a gold bracelet from a client could cross that line. And that's one of those gray areas where it's like, is this a real gold? Is this, what's the value of this gift?
Right.
But understanding that, if you're dealing with clients who may have limited income or anything like that, accepting a gold bracelet could be a breach of that professional boundary.
Mm-hmm.
But offering to pray with the client if they wish, and then sending a sympathy card, I think those are both within the professional boundaries.
Awesome. Okay. Well, let's see how you did. Oh, hang on. Let me do this way. There you go. You got them all correct.
Yay,
So
all right.
great job. So you made some very good points. We want to highlight the topic here as professional boundaries. And this is setting limits that maintain a therapeutic professional relationship between the nurse and the client. Sometimes they can be kind of blurred. And extended into relationships, especially, here we have a situation where we have a home health nurse. So even those boundaries can be a little harder to establish. So we always want to make sure that we're always putting the client's need first and that we're never seeking any personal gain in, the gifts or questions or things we're soliciting or whatever it might be. So in the case of A and D, those both might have some perception of personal gain. And patients are going to offer gifts or things, tokens, I guess you could say, that show their appreciation. And, typically, I guess if we were going to throw a number on it, maybe less than $20 might be okay. But we don't want to accept highly valuable gifts because that is definitely blurring a boundary line. When it comes to staying after work hours and drinking with a client, as you said, very unprofessional. We don't want to be
Don't
doing
do
that
that.
because that is definitely going to it's going to cross boundary lines. It's going to I guess we could look so some things that are indicative of a violation of professional boundaries might be flirting with a client, consuming alcoholic beverages with a client, anything that is overstepping those bounds of a nurse or healthcare provider and client relationship. When we look at B and C, it's appropriate to offer assistance in meeting a client's spiritual needs if the client desires. When it would not be appropriate is if we were forcing certain beliefs or religions or practices onto a client. And then with option C, with sending a sympathy card, this is acknowledging a family's loss, and it's a holistic and therapeutic approach to caring for that family at that time. So great job. All right, let's move on to our next question. A newly licensed nurse is overheard by the charge nurse making negative comments about a client's cultural beliefs during a staff break. Which action should the charge nurse take? A, ignore the comment unless the client complains. B, document the incident in the nurse's permanent employment record. C, pull the nurse aside to provide immediate feedback on professional expectations. Or D, ask another staff member to speak with the nurse about professionalism.
Yeah, well, I think C is the clear answer on this one. Because again, you want to be able to immediately address it and then also provide some professional feedback as to why this is not okay.
Yeah, very good. Yes, that is the correct answer. So you're on a roll here.
All right. You'll get that HR training too. So if you didn't get it on the test, you'll get it when you get employed.
Right. In this case too, this is an example of, using some assertive communication too, when necessary and in an appropriate way and at an appropriate time. So if we ignore unprofessional behaviors, it allows them to continue and it contributes to a toxic and unsafe environment. And we want to work in environments where everybody holds each other accountable for the professional standards that we're going to practice together. When we look at B, documenting it in the permanent record is inappropriate as a first step. So at some point, maybe if it's a pattern, it needs to be documented. But coaching and constructive feedback are always given first, unless the behavior is egregious or repeated. But in this case, we don't have any indication that that's what's happened here. And then finally, with D being the wrong answer, delegating that task is going to diminish the leadership role of the charge nurse. And so it's important that charge nurse take ownership of that leadership opportunity to give feedback in a constructive manner to the nurse who was making the negative comments. So when we look at C, addressing the behavior immediately and privately allows the charge nurse to reinforce those professional standards, model ethical behavior, and provide the opportunity for that new nurse to reflect and learn from that experience. So, all right, let's move on to our last question. So, a nurse on a busy medical surgical unit witnesses a fellow nurse post a TikTok video during their shift that shows part of the nurse's station with blurred patient room numbers in the background. The post includes a humorous caption about surviving another 12-hour shift with no help. What is the most appropriate initial action by the nurse who observed this? Is it A, ignore the post since no patients were shown and no names were visible? B, leave an anonymous note in the nurse manager's office about the behavior? C, speak privately with the nurse and express concern about the post's professionalism. And D, report the video directly to the hospital's social media compliance officer.
All right. So I'm going to work through my thought process here. So first you want to try to eliminate the answers that you know are wrong, try to get it to like a 50-50. So
Sure.
ignoring it is never the right answer. What you ignore becomes more, what you address becomes less. So take that one off.
Good one. I like that.
Yeah. Leave an anonymous note in the nurse's manager office is also not very productive because then there's very little ability for them to follow up or do anything with it. So now you're left with C or D. And that's one of those questions of like, do I address it with the nurse directly or do I report it? And what is my duty to report? And so in this one, I look back at the question. It says, what is the most appropriate initial action by the nurse who observed this? So for me, I would say C, speak privately with that nurse and express that concern. And then I would then at some point need to probably report that. But that's my guess. We'll see if I'm right.
Okay. Okay. So you are.
Okay,
Excellent. You made
yay.
100 today. Great job. So, yes, and I really appreciate you thinking out loud for us in your thought process here because that was really helpful. Because it did come down to two answers that are potentially correct, but highlighting the fact that it's an initial action is important. And it's really important that we have professional accountability and peer feedback. And we talked about that a little bit, but this situation and this opportunity reflects both of those things. So they're part of maintaining professional identity. Although very uncomfortable at times, they're something that we want to make a standard practice of doing in the right way. We have a duty to uphold professional standards, including appropriate use of social media, while also engaging in a collegial communication with those that we're working with. So addressing the concern directly and professionally supports both ethical practice and professional development. So like I said, might be kind of uncomfortable, but probably in the scenario we're given here with the answer choices we have available, it is the best approach to that initial action. So, all right. Well, I appreciate you taking some time to answer those questions with me, and
That was
congrats to you.
fun. It
You
was
did
fun.
a
A little rusty, but I still remember.
you did a great job. So, the one thing I like to ask at the end of my conversations to all of my guests is, what is the best advice that you've ever been given?
The best advice I've ever been given. There's so many gems and pearls. Probably I may switch it a little bit to one of my credos in life,
Mm-hmm.
which is proceed until apprehended. And initially, that sounds kind of like, oh my gosh, like you're just going to go like off the reservation, go crazy. No, that's not what that means. Proceed until apprehended is what when you see something that needs to be done, when you see action that needs to be taken, don't get locked up in paralysis analysis. Act what you think is in the patient, family, coworkers. I'm acting what I think is the best interest of all involved. I'm going to take that action because ultimately, when you get locked up with like, oh, I don't know if we can do this or anything like that, that's where innovation stops. That's where patient experience stops. So many things can happen when you are not intentional in your actions. But doing so also means being intentional in your actions. You all nursing students, when you graduate and you get your license, you are professionals. And wherever you are hired to, they trust you to take care of patients. They trust your decision-making abilities. So you also need to trust your decision-making abilities. Look internally, reflect on it. Don't act, unjudiciously. Don't just go crazy, but think about what is the best next step I can do and do that step and be able to defend it later if you find out it's wrong and that's not the right way to do it. It goes back to that vulnerability piece of, hey, given the information I had at the time, I made the best decision I could with the information I had. If it's wrong, I'm going to learn from it and I'll make a better decision next time. But ultimately, I'm not going to be the one that's stuck there frozen while everything else is moving around me. Sometimes you got to be the one to step out there and go do it. So it's one of my things my team will always hear me say. I say it all the time. Proceed until apprehended. Let's do this. Let's do it right. Let's think about it. And if it's wrong, then we'll fix it on the backside.
That's great advice. And I think it's really good, especially from that, when you transition into practice as a student, it can be like you talked about at the very beginning, 6 months in, you might feel like, I'm on my own and now I have to make all these decisions. And so taking that mindset and using that advice that you gave us is going to be really helpful in taking action in those moments and at that time. So that's excellent advice. So thank you so much for sharing your insights with us today. You've given our students a lot to think about as they prepare for entering into the profession, from defining what professional identity really means to offering practical advice on accountability and boundaries and personal development. Professional identity isn't just about how others see you, it's about how you show up and how you lead yourself, how you advocate, and how you grow. And we may not always feel confident, but the choices that we make and the way we communicate, the accountability that we take, those are the building blocks of professional identity. So the good news is that you're not expected to have it all figured out. You're just expected to start and then keep growing from there. So we'll continue to unpack these themes throughout the course. So stay curious and think a little bit more about how you can reflect on how you want to show up with integrity as you move forward. So thanks for listening to Leadership Chats with Dr. Wise. And until next time, keep learning, keep leading, and stay curious. Thank you.